Turning globally, we've passed another major global milestone in this pandemic. There are now more than 5 million reported cases of the coronavirus. That's worldwide. Yesterday, the World Health Organization announced the highest single-day increase since the crisis began, with 106,000 new cases. But there is hope from some new studies suggesting people who've recovered from the virus do become immune. Dr. Ashish Jha is the director of the Harvard Global Health Institute, and he joins us now from Boston. Dr. Jha, glad to have you on with us this morning. Rarely do we get to report these days on good news regarding the coronavirus, but we have these new studies. The first one involves monkeys who appear not to be reinfected after they've already had the virus. What does that tell us about people?
Yeah, so good morning. And you know, we usually don't get super excited about animal studies because we want to see this in humans. But these are rhesus mac monkeys who are very close biologically to humans. And I think it's just good news that it looks like once you recover from the virus, you really do have immunity, at least in monkeys. We got to test it obviously in humans, but I think I see this as good news.
There's another bit of research from Emory University, not peer-reviewed yet, but promising, seems to suggest that people hospitalized with COVID-19 develop antibodies within 6 days, under a week. What does that tell us about a vaccine timeline, and how good is the news overall?
Yeah, so again, you know, this is a small study. Other studies have found it takes a little longer, but almost every study is finding that after you've been infected and you clear the infection, you do develop antibodies. And again, all the evidence right now points to the idea that those antibodies are going to be protective and it's going to protect you from developing the infection again.
So possibly there could be something like an immunity passport for people who have already had the virus. But let's talk about a vaccine, because a lot of people are waiting on one. The Trump administration hopes to have a vaccine by the end of the year. People have called that a credible goal. But is it realistic? If you're making personal or financial decisions based on a vaccine, would you bet on it?
Yeah, I think the idea of having a vaccine in 2020 is obviously be wonderful, but it is highly, highly unlikely. Just all the things that we still need to do between testing it in animals and actually being able to give it to humans and know that it's safe and effective, I think it's going to be very hard to pull off in 2020. I am pretty optimistic that we're going to have a vaccine in sometime in 2021. My best guess is probably in the middle of 2021, but I'd love to be wrong. I'd love for it to be earlier.
All right. I like the optimism that we will get something eventually, just maybe not this year. I want to talk about two practical matters. The first one, cloth face masks. Many businesses requiring them of customers going back, many governors saying that they work. But yesterday, Dr. Osterholm, a prominent researcher from the University of Minnesota, caused a bit of a stir by saying the research on cloth masks is not good and it may give people a false sense of security. So I want to put the question to you. Is it helpful for people to wear cloth face masks as they go out and do their business?
So I think it is helpful. I think what Dr. Osterholm was saying, which I agree with, is it's not a substitute for everything else. It's not a substitute for social distancing, keeping 6 feet away, washing your hands. If you think the cloth mask is good enough and you don't have to do anything else, that probably is risky. But cloth mask on top of all the other things we've been doing, I think is added protection.
So let's talk about some of those other things we've been doing. The CDC is now saying that the virus does not seem to survive well on surfaces. Does that mean we can stop wearing gloves, as some people do in public? Does that mean we don't have to wash down groceries? We can go a little bit easier on those fronts?
Yeah, so I believe that you know, the data that's coming out is that most of the transmission is really people to people and not from surfaces, and therefore I don't think there's much reason to be wearing gloves out in public. It is critical not to kind of touch your face and touch your eyes with your hands. Wash your hands. I've never really believed that washing groceries or wiping them down with Clorox wipes is necessary, and I think more and more the evidence is you don't need to do that. Just again, wash your hands carefully, and then from other people, stay away at least 6 feet and do all the stuff that we've been doing.
All right, Dr. Ashish Jha walking us through some positive news this morning on the coronavirus. Doctor, thank you very much.